West County Health Centers to work on our Innovation Hub projects. We're featuring our telehealth and video visit projects. Both organizations have done a lot around deploying telehealth technologies to reach patients in new ways and reach patients that we maybe wouldn't have reached otherwise.
At Petaluma Health Center, we've noticed that patients often have a hard time accessing their home team, their medical home or their dental home or their mental health providers. And what we've tried to do with implementing video visits is really connect the patients back to their medical team.
Here at the Petaluma Health Center, we are featuring 3 projects. Our medical dental integration, our telepsychiatry, and our transition of care hospital discharge case management program. Our telepsychiatry program, we essentially have set up the patients with a mobile telehealth cart. They are roomed by a medical assistant, and they set up all the technology for them. And they sit in a normal therapist office while our psychiatrist is at his home office. And we establish a connection via WebEx Cisco.
Patients admitted to the hospital frequently leave the hospital without knowing their diagnoses. They don't know what medications they're supposed to be on. We dispense to each of these vulnerable patients with chronic conditions who are being discharged from the hospital an iPhone that's locked down to be able to video conference with us or call for emergency services. And with that iPhone, they have a direct connection to us. We've been doing teledental visits for about 1.5 years now and have found them a real successful way to get particularly kids plugged back into getting regular good dental care. When Brenda, our RDA, goes in the room with the children and gives them the toothbrush and the floss, they definitely light up. They really connect with her. They love seeing their dentist on the video, and it definitely is a good way of getting them to feel more attached to their dental home and get in for follow-up care.
I think the beauty of telehealth and video visits for us is the simplicity of the technology. A lot of the technologies already exist, do not require too much tech integration. They're simple workflow changes, and using some pretty standard technologies like WebEx Cisco, iPads, iPhones, existing laptops and computers. So it's fairly simple to deploy. It also allows us to really reach people that we normally wouldn't reach. We sometimes are asked how we're able to deploy so many video visit projects so robustly across our organization and West County Health Centers across their organization. It's just there is a strong culture of innovation here. We've done training with our staff and our leadership around innovation. We've identified it as a core value. We've invested in partnerships with telehealth companies and health tech startups. I think the most important thing that our video visit and telehealth programs have provided is the opportunity for us to deliver care to people that maybe normally wouldn't be able to have care, at times that they wouldn't normally be able to have care, and in ways that they definitely normally wouldn't be able to have care. It makes sense for the quality of life of the patient, and it makes sense for the bottom line of our healthcare system.